I'm Dr. Marsha Sanity,
And I'm Dr. Caleb Moore,
and this is
the Free Smiles Podcast. Today we are discussing working interviews.
How to nail your next interview, and I think this honestly applies to not just dentistry, like not just dental interviews, although that's like the ones I know the most about, obviously. I think a lot of practices right now are finding, we're all trying to grow. We're trying to find better, good talent or do this or that, or, people are moving, retiring. I think during COVID, a lot of people, they decided to retire, not come back into dentistry. Hygienists are one of those, but I think also in front office. It was a really stressful time. So I think the hiring aspect and finding the right people is hard on our end, but I think also finding the right fit for you in a practice and what it means to come into an interview, what kind of things that we're looking for. I think in general, like I think it's a pretty universal thing to nail an interview and just to present yourself in the right way. Yeah.
And it all boils down to communication for me. Because when we talk about nailing a working interview, it's not just for the people who are doing the working interview, it's for us who, we have to nail that as well. So especially if you're excited about this person or you've chatted on the phone and you have a really good feeling about them, it's how do we make this experience go well for everybody? So, and ultimately at the end of the day, we're assessing during that day.
Yeah.
But we really want to ensure it's going to be a good fit culturally for everyone.
For sure. Yeah. And it really is. It's like a first date, or maybe a second date at that point. Because usually for the interview process for most offices, and I've experienced this as well when it comes to, finding a new job or finding a new person to bring to the team. So you usually have a phone conversation because, you don't want to waste anyone's time. You want to kind of sort out those things. You're probably looking at someone's resume. They're probably going to be looking, and you should be looking at the website of the office that you're going to look for. Do they have a social media presence? What kind of things what procedures are they doing?
Yeah.
I think doing a lot of research on the front end to really get to know that office. I mean, obviously when you're applying for jobs, you're applying probably for multiple different jobs because you're trying to figure out, hey, let me just apply to a few different positions. Let me figure this out. But I think just doing a little bit, just like a 5 to 10 minute research on what that practice is all about, so you know what the right questions are to ask, and you can kind of dial in some of those nuances of, hey, is this the right fit for me?
Yeah.
So I think that's my first thing when it comes to an interview is doing some research. And then they're probably going to try to do some research on you as well, not only with your resume, but a lot of offices are looking you up online. They're looking at your LinkedIn. They're looking at your social media presence and how you present yourself to the world. Because it really does tell us a lot about you and vice versa.
Who you are, what you value. I think, if I'm looking for a new position and I'm on the phone with someone who wants to hire me, a good question to ask is, why is this position available? I really want to ensure that culturally I'm going to align with the team and with your goals. So, why is this person leaving?
Yep.
I think that's a really important question to ask.
Yeah, I think that's really important. I think it's, and that question can lead to a bunch of different answers. It could
Exactly.
be that office is growing and expanding. They've hired another doctor. They now need to kind of fill, assisting positions and an extra hygienist to then support that doctor. Does someone retire? Did someone move? Did they have a bad experience with an associate? Now that associate is no longer with that team and they're trying to, whatever it may be. I think there's a lot of different answers to that, but there's also some red flag answers that can come from that. But I think just knowing what you think you want from that answer is the most important part of that.
I like the analogy that you used of a first date because
Yeah.
that's a hard question to ask, or, you go into a first date, you're not going to ask somebody, well, why are you single? Like, what issues do you have? It's like, so
maybe people should ask that question, actually.
And maybe they should, and I think it's all about how you present yourself and the tone to show what your intentions are, what you're looking to gain from these answers and these questions, the questions that you're asking, I could be looking for a negative response, but if you're communicating in a way that allows the person hiring you feel like, hey, they're really interested in this and they really want to know more, then you're more than likely going to get to the next step. Yeah.
Yeah, exactly. I think asking questions that, it was it more of a conversation, you know what I
Mm-hmm.
mean? And I think if an office isn't willing to answer those questions or answers them weird or shifty or not directly, then there's probably something more you want to know about that. And the same comes with us answering those questions. Like when I first interviewed for the office that I'm with right now, um, we did a phone interview first, then we did a in-person interview, then we did a second in-person interview.
Mm-hmm.
Even though it was a pretty rigorous process, which I think it should be. I
It should
think,
be.
and I wanted that second interview, and I even asked for observation days that I can actually go in and just observe the office working. Because to me, I wasn't going to make a jump or, kind of uproot my current situation if it wasn't for something that I thought I could be at for some time. So one of the questions that I asked the doctor, the owner of the practice, was, "Hey, what are your goals for the next 5 to 10 years for this practice, and where do you see yourself?"
Mm-hmm.
In that answer, I want to know, does that mean that you're, as a doctor, are trying to do less cases? Are you giving me your patient load? Are you trying to have less patient hours? Like, or is it that you just want someone to take the cases that you don't want, and then
Yeah.
I don't want to work with you as well? So there's a lot of things, but you need to kind of know the answers to the questions that you're searching for.
Yeah.
And maybe you'll get an answer that's like, oh, that's actually something I didn't think about, or that's something that I'm actually really interested in. So yeah.
And then you could take it to the next level of, okay, well, this is what you're looking for. How do I meet or exceed your expectations in that role? What does that look like for me? What are my expectations if I'm joining the team?
Hmm.
And then it gives you a roadmap of what's going to be expected from you and if that aligns with what you want.
Yep,
Yeah.
exactly. I think it has to be a two-way street, and I think people that think about things ahead of time are the best people to hire
Mm-hmm.
because it doesn't have to be someone that has the most experience. I think this is very true when it comes to assistants and when it comes to even a really good hygienist. To me, I think the most important thing is just having someone that has the personality type that they want to continuously learn and grow.
Yep.
They are really good with self feedback, like they're essentially taking each day as, hey, I could have done this better or not. This is how I critique myself on something because no one's doing anything perfectly. And I think the right team or the right growth in a team is when everyone wants to do better in that situation. So, I mean, maybe not all offices are like that. Maybe people just want someone as a warm body, maybe. But I think if it's really a long-term move for you, you really should be looking for a practice that has good goals and that you can grow and change into in a good way.
And like you said earlier, it's a rigorous process
Mhm.
for both people. Um, I know, moving out of the dental sector here for a minute, my partner has had a really hard time transitioning in finance here. It can be mentally exhausting when you have so much to offer to a company or to a dental practice,
Mhm.
and they're trying to hire quickly. Is my point of this.
Mhm.
So a lot of these other companies are just, we need a body to fill this role, and you submitted your application 2 days later, or your resume maybe has a gap here versus somebody else doesn't.
Mhm.
They're not taking the time to have those multiple meetings or to ask those harder questions to ensure that it's a good cultural fit,
Yeah.
which is like, it frustrates me to no end, because I'm
Mhm.
like, if you would just take a minute and slow down in this hiring process, you would find that this candidate would actually align really well with your company
Mhm.
and has a growth mindset, versus you're just looking to find someone to fill this spot immediately. What is that going to do for your team long term?
Well, I think that's the one thing about dentistry that I've always really thought stood out as a career option and a career field is
Hmm.
when you go into it, you really are working for a small business. You're working within a small team. Every single person in that office is a pivotal role.
Yep.
Your What you bring to the table is valued and you make an impact on every single person in that office, every single patient. You can make changes and you can really impact a lot of things where I think when you think about, working for a big corporation, working in something like finance, working in, whatever it is, IT or something like that. Obviously, dentistry is very patient focused and very, one-on-one
Yeah.
person focused. Not everyone loves that in a career field. Some people want to be more behind the scenes. They don't want to deal with people. They want to be more on the phone or they want to be more behind a computer. And I think finding that in yourself. But I think a lot of people go into this being in different fields. Like one of
Mm-hmm.
my best assistants, and I've think I've said this a few times, was a young man. He was in construction. Had really
Yeah.
no background when it came to. I mean, he obviously worked on like teams and like construction and working in that sense, but when it comes to like patient care, like having someone feel at ease or like being comfortable in a really uncomfortable situation, like the field of dentistry is for a lot of patients, and his personality though took really well with that. Like I
Mm-hmm.
think I helped him or we helped him see, and I saw that within him. Like he was a young guy, I think 19, but he wanted to learn. Like he was the most like on it. He's like, "Oh, you need this, I'm going to do it. What else do you need me to do?" Like
Yeah.
he wanted to learn and grow, and he became one of my best assistants over people that were doing it for years and years before that. So I think going back to the notion of your willingness, even if you don't have experience and you do want to get into something different, I think just doing a little bit of just self-reflection of, hey, what kind of person am I? Am I actually willing to go above and beyond to try to stand out in this field? Not that I have the experience to do it, but my like what I am and who I am as a person. I think that's what honestly got me most of my jobs in
Yeah.
this field early on in my life, was because my work ethic was like a 50-year-old man that worked in a factory. Like that's where am I that's where I came from. Was there was no, end to my day. I didn't
Yeah.
have, I didn't complain. I was just trying to learn the most, do the most, and um, you know, just take that with like just being humble and wanting to grow.
And those are core values that you have within yourself. Something that you said earlier, all of the jobs that have been, that I have had the opportunity to work in that went really well. And it was a good experience for me, whether I left that job
Mhm.
or, all of those opportunities started with a conversation. So if you're in that first initial phone call or interview and your core values align with that company or that dental office, it's going to be easy. It's going to be easy to converse with somebody,
Mhm.
um, because they know, they can see it, and they can see who you are as a person.
Mhm.
And I think that's one of the reasons, professionally, that you and I have connected the way that we have, is because of that. Um, but I just think that's very, it's very easy to show that when it's just how you operate every day.
Yeah.
It can be harder if you're not showing that during the working interview. And what
Mhm.
I mean by that is you have to be able to show the other team members throughout the day that you are willing to jump in and help out. And
Mhm.
so there are ways that you can crush a working interview. And I think one of that is just being very team oriented
Mhm.
and helping out the team when you can throughout the day.
Yeah, and actually that makes me think about like even temping. So there's one thing
Mm-hmm.
and I try to like instill this into like the doctors that I work with now. When I was a temp, when I was in dental school, I would temp at different offices. I really got the lay of the land of when you're temping, you get like this outside perspective of how that office kind of works. You're kind of in the background a little bit.
Mm-hmm.
You're seeing the ins and outs of that, but a lot of temps get a bad rap because you're a temp, whatever, why don't you work somewhere full time? Well, a lot of people don't work full time because they're going down to two days a week because they have family obligations or
Mm-hmm.
they, this and that. It's not because they can't hold a job. So I think not discounting like a temp that works with you and
Yeah.
kind of doing a little bit of pre-interviewing with that temp that's coming in, giving them extra time in the morning to kind of get to know the team a little bit and what your expectations of that is, because a lot of times that temp can turn into someone who works for you more frequently or
Mm-hmm.
takes a full-time position with you or takes a part-time position because they really like you and you like them. So I think not discounting a attempt that comes to help you out in the meantime when you're looking for a new someone to fill a position. And temps talk.
Mm-hmm.
People that go to different offices know different people from all over. Like I knew pretty much, I would say most practices in Colorado by the time I was ready to work as a dentist here. And I knew the offices that I didn't want to go to. I knew the type of corporations that didn't I didn't jive with well
Yeah.
for my goals. And I think a lot of people don't realize because they're used to doing like their in practice. That's the brown practice they've worked with. As a doctor that's trying to hire, you don't realize that all these temps know each other.
Yeah.
They talk on social media. They know they're like, oh, don't work for this, whatever. This guy does this, or this
Mhm.
is happening here, or it's not that it's always a negative thing. It could be a really positive thing. But I think always putting your best foot forward and trying to communicate in those situations can go a long way as well. If you're really trying to find people to work in your practice.
So if you have someone coming in for a working interview, what would you say is most important throughout the day? I mean, putting your best foot forward, how are you doing that in a way that is not crossing a boundary of, because at the end of the day, we want to let them be, we want to assess them and ensure that they're going to fit well.
Mm-hmm.
But how are you putting your best foot forward to support them? Yeah.
Yeah. So I think the most important thing is having them come, like during the interview process, talking about the office. That's all well and good. But the day that they're coming in for that working interview, having them have, an extra amount of time in the morning.
Hmm.
So, when you're temping, you only get like 15 minutes, then you're just going.
Yeah.
But for an interview, you really want to let that person be set up for success because when you're in a new space, you don't really know where things are. Even if you get a brief overview of certain things, there's like different computer systems. So I think letting that person come in probably 30 minutes before your first patient arrives, if your huddle is 10 minutes till or whatever it is, giving them some time to orientate with one person that's designated to do that. So one
Hmm.
person that knows they're training that person for that morning, setting that up properly. If it's a hygienist, having one of the other hygienists be there a little bit early to get that person onboarded, and then someone up front, obviously, because you're going to pay that person, having all that paperwork and stuff done just pre ahead of time. So then there's no confusion at the end of the day as far as you're starting at this time, take a lunch from here to here, and then we're ending at this time, and
Yep.
we're going to do maybe a post chat at the end of the day. But I think just setting that person up for, showing them a computer system, knowing what their experience is, like, hey, do you know these certain things? What kind of dentistry have they been assisting on, and how you
Hmm.
guys like things? And that's a lot of information to go over. So I think just hitting the key facts of, hey, we do four-ended dentistry with our fillings. Our doctors place our fillings, or we allow our assistants to do our fillings. We work with EDAs in this sense, or our EDAs only do this,
Hmm.
XYZ. Just kind of setting those expectations and just briefly going over how you communicate with your patients. So we like to greet our patients up front. We say these couple of things. We like to introduce ourselves by name or whatever it may be.
Hmm.
And then, kind of orientating patients like, hey, we always have them do this pre rinse. We let them sit here. We do Netflix for like little things like that. Not that they have to know everything or be perfect on it, but you really want to let them know like these are our procedures for the day. This is typically how we set this up.
Yep.
Yeah.
So essentially giving them a roadmap to succeed throughout the day, because if I'm walking into a new practice, it can be very overwhelming. I
Yep.
don't know where anything is, and I'm thinking I really want to nail this today and show, that I am a good provider,
Mhm.
but it almost feels a little defeating when you're like, I can't fumble around and have to find where the etch is or,
Yep.
things like that. So giving them a roadmap to follow so they can be like, okay, I know that if I run into a problem here, this is who I need to go to for
Yep.
support, or this is where, these instruments are found. I really like that you said that. But then also, one other thing you mentioned was just, okay, after they have that roadmap, assess how they're making decisions throughout the day and how they're communicating with patients and your team,
Hmm.
because that's going to give you everything you need to know about, about them as a provider and how they're going to fit in.
Yeah, and I think the biggest part of what you just said was how they're communicating with patients.
Hmm.
Because to me, the hardest thing to train, it's not the skills of setting up instruments or setting up a procedure or learning to do better at certain procedures, because you can train that. I think personality is something that you can't change. You know what
Hmm.
I mean? Like, if someone is your office, I think in general, most dental offices want to create like a calming environment for their patients when you're coming in. You don't want hecticness, you don't want chaos, you don't want
Yeah.
someone who is like overly, like, overly boisterous. Because a lot of patients coming in, I think just knowing this for the field of dentistry, if you're trying to work in the field for the first time or if you've been in this field, most patients, especially if they're meeting someone new in
Hmm.
a thing that's already uncomfortable, they want someone that's just calm, confident, and
Yep.
puts them at ease. And I think if you're really good at that, and I think there's a few key things that you can learn to be better at those skills. It's just, kind of reading the room a little bit. I think not being an oversharer. I think
Mhm.
I've met a few team members over the years that the ones that didn't jive, or the ones that made the patients feel uncomfortable, like the patients that would tell me afterwards, like, I literally had this happen this week and I actually should share this. So we have a working interview. We're trying to hire a new assistant. Our team is growing. So um, Dr. Tom and our office manager met with this person. Initially, it was me and the other associate that were working with that
Mhm.
assistant for the day. Lots of experience. He's EDA trained, is used to doing a lot of things, but in our office, our doctors do more than, like, as far as we place our own
Yeah.
fillings and we do that stuff. So she was fine with that. But during the day, like in the morning, she worked with the other associate, and in the afternoon, she worked with me. So I didn't really get to know her in the morning.
Mhm.
But in the afternoon, so I was working on a patient who has been coming to this practice for decades. Like, he's been a well established patient of ours. I was doing a crown on him that day. At the end of the appointment, it was the end of the day as well. So it was the last patient of the day. I was in my office doing my notes. My one front office team member came back and she said, "Hey, so and so just wants to chat with you really quick." And I was like, "Oh, okay, no big deal." So I walk out and I said, "Hey, what's going on?" And that's like not a thing,
Yeah.
you know what I mean? A patient doesn't usually like want to talk with me after a procedure. We usually have like the communication and
In the
then they're
appointment,
good.
yeah.
So he's like, "Hey, can we just go somewhere like private or somewhere that we can chat?" And I was like, oh, "Okay." So we went to the consult room, and I was like, "What's?" My eyes are really big. I'm like, "What's happening?" And he's like, "Everything's fine." He's like, "But the team member I worked with
Mhm.
today, like, he pretty much said like she was someone who was like constantly talking, like throughout
Yeah.
the appointment. She was just like saying things, talking about stories, well, like, but talking really like almost like rapidly and loudly and
Mhm.
just like irrelevant things. Like, just like talking, talking, talking. He had like his headphones in. He was just trying
Mhm.
to like relax, watch a movie, and he literally had to like take his headphones off because like she was chatting so much, and I was trying to like damper her
Yeah.
a little bit by just giving like really short and precise like conversation. I don't want to be like, "Hey, can you stop like, it's hard. It's hard to like
Yeah.
when someone has that like very loud boisterous personality. Not that I don't like that, but for a lot of patients it's uncomfortable because they're trying to relax, get their head out of wherever they are. They're trying to just
Mhm.
tune us out. And if someone's talking over the noise canceling headphones,
Oh,
it can be
yeah.
a very unsettling, it can be a very
Very
uncomfortable
unsettling.
situation. So this patient who's been coming there for years was like, I'm so sorry. Like, it's not my place, but I really want to give you feedback on this new hire." I was like, "Oh, first off, she's a working interview. I think we've observed a couple things say that she's
Yeah.
probably not gonna be a good fit for us for a few different reasons." But he like took it upon himself enough to kind of go out of his way to give me feedback.
Mhm.
So to me, that was almost like alarming. Like, I like was so apologetic. I'm like, I'm so like, I never want a patient to feel like the person that they're working with was like the ugly ducking of the group. You know what I mean? Like
Yeah.
the lowest person that
Mhm.
wasn't really well trained, like didn't have the right skill set. And people know this. People know when someone's working on them that they're not really comfortable with what they're doing. And you can be a little fumbly on an interview. Obviously, you can be a little like out of sorts. And maybe she was like a nervous talker. I don't know. But it was something that just stood out to me as like, how do you let someone know that that's happening when they're on an interview so then your patients aren't
Mhm.
uncomfortable without kind of sounding, I don't know, like you're trying to like change who they
Change who they
are,
are. Yeah.
Yeah.
And I think that's a delicate balance. Because you don't we're not trying to change who they are. We want to know if they're a good fit or not.
Right.
And at the end of the day, we have a schedule booked out for them for the day.
Mhm.
But patient care is a priority. So, that's very tricky to navigate because you want to correct the behavior because you value your patients and the care they're receiving for the rest of the day.
Mhm.
But I think that's just one of those things that you take the risk on. Um, and I think you handled that perfectly with the patient.
Yeah.
And you just communicate that with her at the end of the day that, like, hey, this
Yeah.
is not
I mean,
um,
yeah, it
gonna
was
work
tough.
out. I mean, I have a very similar experience, and I don't mean to laugh at your story. I wasn't laughing at your
Well, no, I
story
mean, me and my
because
assistants did like, you have to kind of laugh about it because when things are so like when you're trying, you have to laugh because we're going through this process, and there, you meet enough people, you're
Mm-hmm.
trying to interview, and you're only trying to select a few people to do working interviews that are the right fit. So I think me and our assistants who have been there for like decades, we're just kind of laughing about like, how did this person slip through the cracks
Yeah.
of like the initial screening process?
Mm-hmm.
Like what was it in that? Because I wasn't there for the initial interview part of it, and we were just like we were kind of laughing because like we all like at each person's like checkpoint of meeting her, everyone had the same like end thought
Mm-hmm.
like thought about her, but I was the last person to like meet her that day. You know what I mean? Like I
Yeah.
was there at the end, and I was like, why did no one say something earlier in the day about what was happening here? Um, but
Yeah,
anyways,
my
yeah.
team, yeah, my team's experiencing the same thing with one of our new hires, and it's difficult because, you know, at that working interview, she she has a lot of highs and lows, and I don't really want to get into it today, but a lot of highs and lows, and I think at a working interview, it was a very good day,
Hmm.
and now there have been a lot of bad days, and at the end of the day, like you said, patient care is top priority, and um, so when that is happening, it's very you have to be able to ask hard questions during a working interview and maybe have some scenarios that you're going to put them in to see how they would respond, because at the end of the day someone could show up and be able to assist really well, and I actually didn't work with her during the working interview, um, but even if they do show up for that day, what are you going to show up like every day, and
Hmm.
is your personal life going to affect coming in tomorrow? How are you going to be treating patients?
Yeah.
Because I don't want someone who seems like a really good fit when they're in for the working interview because they had a really good day, and then the next day they come into work without any shoes or something insane, like, and I'm laughing because it actually happened. um so it's how do we navigate that working interview to ensure that it's going to be a long-term fit, because that's what we're looking for.
Well, that's honestly why I feel like it is like a first date because, um, I mean, I say this as in like I haven't had that many first dates, but thankfully, I would be probably be a very bad dater nowadays. But yeah, you meet someone, and obviously on
Hmm.
a first date, everyone's trying to be like, their best self. And but I hear these stories from like girlfriends of mine, or I'm part of this woman's group now where we meet and we talk about like different like political things, and we're all from different. It's almost like The View, but not The View. I guess I don't know who I'd be in that like scenario. But we talk about different things, and a lot of these women are single or divorced and like now dating again, and they go through these like scenarios of like, oh, this is what this guy said to me, or this is what I'm like, oh my god. But I feel that way a little bit when it comes to interviewing. I'm like, you had what happen? What did they say to that patient? And you're just trying to like not get over like stimulated by the process because it really can be exhausting. Like I left that day feeling exhausted
Hmm.
because of how much she was talking at me. Not even
Hmm.
like talking like through a conversation, just
Yeah.
like I just don't respond well to like I don't know, that kind of personality type, I guess. But that's me.
Yeah.
Maybe some doctors do. Maybe they
I mean,
want
maybe they
someone
do.
that is that way.
And at the end of the day, there are a place for those talkers. She'll
Mhm.
find her home, and there will be an office who, the type of patients that they're seeing will value that. But it's just not a good fit for you guys.
Yeah.
So, what are your key takeaways in terms of what you're looking for, and not only as someone who's hiring, but someone who's also interviewing?
Mhm.
What would be your takeaways from today?
Yeah, I think I think going into an interview, it's about having some good questions. Just having one or two questions about that office because it makes you look prepared. I think that's always a good thing when it comes to any kind of interview that you're doing. Just having a little bit of information, a couple of questions. You could literally even like Google questions to ask. Like it's you don't have to like make it a big deal. So doing that and then being presentable, I
Hmm.
think, and that doesn't mean you have to come in like wearing a suit and tie or wearing just having that one outfit that you're comfortable like you're I want you to be comfortable because when
Hmm.
you're uncomfortable then it shows like you're kind of shifting, and I think just treating it like a conversation more than anything, I think the best interviews that I've had personally going into or been interviewing people for are ones that it really is a conversation. I think the same thing about like dental school interviews.
Hmm.
That process can be so frustrating and so almost intimidating in a way. And I think a lot of people feel that way. So if you're just going into it like, hey, this is just a new person, I'm just trying to get to know them. And there are some good books about like conversation and like how to be a better like conversationalist and just be that way. And then the last thing is just really being focused on the patient and then your team. So there's always this kind of thing of the hierarchy in an office. Like the patient's always the most important person in the room.
Hmm.
Your team is then like the second. So if I'm not being needed for this patient at this point, the patient's seated, they're comfortable, everything's going, kind of well. I'm gonna check in on my other assisting team. I'm gonna see if they need anything. I'm gonna check in on the hygienist if they need help flipping a room, just being communicative in that way. Does the doctor need anything? Is everything going smoothly? And I think just kind of having that little bit of awareness, even if it is a new environment, it's never a bad idea to ask questions. It's you should be interviewing us as well. Like you should be interviewing the people that you're working with.
Yeah.
And I think that bodes well for you to be more interested. If you're asking questions to other team members, how long have you worked here for? How do you like it? Why did you choose to work here? I think those are just really good questions just to know. And I think you'll really find something that is a good fit for you just with those few things.
Yeah. Well, I totally agree. Confidence is key, knowing what your core values are, and finding a team that aligns.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.